Welcome to our monthly Telechat. Thank you all for joining us tonight for what we think will be one of our very best Telechats of 2012. We're delighted to have you here with us to talk about emotions after a cancer diagnosis. I don't think there's a survivor out there who has not struggled with anger, sadness, depression, etc. Even those who are in remission years later still struggle. So I'm confident you will all benefit from tonight's topic. A quick review of how this works. The operator will come on and give us instructions again when it's time to ask your questions. This telechat is being recorded and will be available this Monday on CCA's website, www.ccalliance.org, in our library. Most of you know me. I'm Jeannie Moore, Patient Support Manager for the Colon Cancer Alliance. And also with me is my partner in crime and dear friend, Patient Support Advocate Martha Raymond. Our speaker tonight is Jolene Rowe. She was a speaker for us at one of our conferences a few years back, and we are very fortunate to have her here with us again tonight. Jolene is a clinical social worker at Moffitt Hospital, the National Cancer Institute in Florida, since 1991. Her bio is very impressive and is on our website. She is currently the coordinator of the Families First program at Moffitt. Thank you, Jolene, for giving up your night to be with us. The floor is yours.
Oh, well, thank you for inviting me, and good evening to everyone. I'm really happy to be here tonight and have an opportunity to talk with you about dealing with emotions after cancer treatment. And tonight I'd really like to talk about focusing on becoming a healthy survivor. And I'm not sure how you identify yourself or think of yourself, but the National Coalition for Cancer Survivorship describes anyone at the point of diagnosis and discovery of cancer and for the balance of life as being a cancer survivor. So we're going to talk about what it's like to be a survivor, what are some of the things that you may have experienced, and what are some ways for really improving your quality of life. And I do believe in the audience we have a wide range of survivors that includes patients who perhaps have just begun treatment or in the middle of treatment, and some of you who have completed treatment, and maybe even some who are well beyond treatment and doing well. So I'm going to talk about the emotional experience across the spectrum and across the journey, the cancer journey. And I think any cancer patient, any cancer survivor knows that cancer is really more than just a physical disease. It really impacts every dimension of your life, your social life, your psychological, spiritual, financial, practical, and your relationships. But tonight we really want to focus on the emotional dimension, and that's the impact that living with cancer has had on your emotional well-being and really your overall quality of life. And I want to start by just acknowledging and validating, for those of you who are living with a disease, the many emotions that really are so commonly experienced when you're diagnosed and living with cancer. And maybe you've not had a chance to talk to a lot of other cancer patients or to hear what they're going through, but it's important to know that what you're experiencing is normal. It's very common. It's not unique to you, that really there are a lot of shared common experiences among cancer survivors, and that you're not alone. There are 10.8 million cancer survivors out there, and all struggling and striving to learn to cope and have good quality of life after a diagnosis. And the good news is that people do have good quality of life. There are a lot of ways to manage the emotions that you're experiencing and a lot of ways to improve your sense of well-being. And so once we have a chance to talk a little bit about what some of those strategies are, I'll have a chance to hear from you. I'd love to hear your comments, your suggestions, and your questions. But I want to first begin by just acknowledging some of the common reactions, emotional reactions to cancer. This isn't new to you. You've experienced it, but it's common to all cancer patients. That shock, that denial, that panic, maybe the disbelief when you hear the diagnosis, the sense of helplessness or loss of control, the vulnerability. For some of you, it may have been anger or despair. Certainly with a cancer diagnosis come multiple fears, fears of death or disfigurement, and oftentimes depression and anxiety. And even well beyond the initial diagnosis, there are emotional reactions. And for many patients, you hear patients talk and they say, oh, I can't wait till treatment's over and everything is going to be back to normal and I'm going to feel better. And so most patients expect to feel relief at the end of cancer treatment and completion of treatment. And oftentimes that's not really the case, that there are as many emotions that you experience upon completion of treatment as you did at the time of treatment. And some of those emotions may be relief, but there's also a certain uneasiness about completing treatment. And that separation from your medical team, that close monitoring and supervision, and someone to call or talk to when you have fears or concerns about what's happening to your body. Patients at the end of treatment may feel abandoned when they can no longer talk to their nurse on a regular basis or see their physician. You may also experience some loneliness and a sense of isolation. Things have changed for you, and maybe people out there, your family, your friends, your coworkers, don't really quite understand what you've been through, and you can't really talk to them about it. They don't understand. They're ready for you to get on with life, and so they may have expectations that everything's okay. There may be disappointments that the people that you had hoped would be there for you are not, or were not during your treatment. Certainly after a cancer diagnosis, many patients experience just a sense of that increased perception of mortality, that you live with a lot of fears. There's an ongoing uncertainty about what's going to happen next. And so the period after completion of treatment can be as distressing as at the time of diagnosis. And a lot of patients describe sort of symptoms of post-traumatic stress. And it's no wonder that many patients feel that way. Just like any stressful event that's traumatic, there's been a threat to your physical integrity, the threat of potential death, intense fear, and a sense of helplessness. And those kind of experiences are traumatic. And I'm sure it won't surprise you to know that up to 30 to 40% of cancer survivors experience what we call clinically significant distress. And distress is really just a global word that describes the unpleasant emotions that occur normally with a cancer experience. They could be depression or anxiety or fear or worry. I do want to take a minute to talk a little bit about depression and anxiety because those are the two emotional reactions that you hear the most about. And it's really important to differentiate between normal sadness and what we call a clinical depression. Certainly, sadness with the experience and depression are on a continuum of severity, and some sadness is normal. But clinical depression is something that usually requires some professional intervention and help. And when we talk about depression, there are a number of symptoms to look for. Certainly loss of interest in previously enjoyed activities, a feeling of helplessness, hopelessness, worthlessness, and guilt. Sometimes even feelings of wanting to harm yourself, suicidal thoughts, feelings of being overwhelmed, having difficulty making decisions. And then depression disrupts your concentration, your ability to eat, and your ability to sleep. Of course, as a patient who's undergone treatment or maybe on medications, those symptoms may be a result, the inability to sleep or eat or concentrate, of perhaps treatment, medications, or long-term effects from the care that you received. But the real symptom that is an indicator that you have a more serious depression is the loss of interest in previously enjoyed activities, that the things that used to bring you joy do not, that you can't seem to enjoy anything, and a sadness that becomes debilitating. And certainly that's the type of depression that you would want to seek professional help for, and can certainly be managed with counseling and medications. But again, for most patients, the sadness does not become debilitating. It's a normal sadness that's really what we call an adjustment reaction. It's a reaction to what you've been through, and a reaction to the losses and the changes that cancer has brought to your life. In terms of anxiety, that's really the most commonly reported form of distress, and I'm sure you're not surprised by that. And anxiety is also on a continuum of sort of normal worry and fear to much more severe anxiety and panic attacks. And some anxiety and fear are very normal, but if you're experiencing feelings of dread, hypervigilance, constant irritability, and even panic attacks, then that's more serious and requires, again, some professional intervention, sometimes medication, counseling. Those can be helpful in managing the symptoms, the more severe symptoms of anxiety. And a lot of patients do need some extra help at some point during the illness or beyond, and there are a lot of resources available. And so I really encourage you, if you find those symptoms to become debilitating, to seek out professional help. And certainly ever if you're having thoughts of doing harm to yourself, that's something that requires immediate intervention. But I want to talk more about what's more common among cancer patients, and that's the sadness that really is associated with all of the losses that you've been through. And a lot of people mistake grief for depression. And grief is really a reaction and an expression of loss, whereas depression is not necessarily related to a particular event. And with cancer, there are many losses, and I'm not sure that people talk about it in those terms, that people really acknowledge the significant losses that may not be so obvious. I mean, clearly any kinds of physical changes or losses are very apparent. If there's been an alteration because of surgery, or loss of bodily functions, loss of physical stamina and independence, those kinds of things are very apparent. Loss of health. For some patients, there may be other losses associated with treatment, fertility, and for some patients as well, there are losses related to sexual intimacy. And certainly, hopefully, if you're someone out there who has had surgery or has had a colostomy and major bodily changes, that you've had an opportunity to talk with a professional and learn how to care for yourself and to go on doing the normal and important things in your life, and that includes your feeling good about your body and feeling good about your physical self, your integrity, and enjoying sexual intimacy. And some of those things are not talked about, and those are great losses. Those are profound losses, not only for you, but for partners as well. Certainly there are losses socially, the roles that you played in your life, whether or not you were the primary caretaker for your children or you were the breadwinner in your household. If things have changed and you're not able to do that because of physical changes or treatment schedules, those are losses. Losses in relationships. A lot of patients report that once they've been diagnosed with cancer, that people that thought or their friends or would be there for them or not. Certainly treatment can disrupt work and careers, and there can be a loss of work that you found meaningful. Psychologically, losses include that loss of a sense of well-being. You know, I'm a healthy, strong person. That loss of sense of control. You know, how did this happen? I feel helpless. I don't know what cause this, and sometimes a loss of self-worth. When you're not doing the things that made you feel good about yourself, perhaps work or parenting or volunteering or whatever those things were in your life that made you feel good about yourself, there's a loss there. And then what we call existential loss, that sense of meaning that, how could this have happened, or why did this happen? I just got married and I've become ill, or, we just retired and we're looking forward to travel, or that this disruption and change in your life can seem cruel and senseless. And so there are a significant amount of losses with a cancer diagnosis. And loss, in order to get over loss, there has to be grieving in whatever way that you grieve. And again, a lot of times I'll hear patients say, I'm crying all the time and I don't know why. I think I'm depressed. And a lot of it has to do with the loss and the need to grieve. But with the opportunity to acknowledge the losses and grieve, there's an opportunity then to move on and to feel better. Certainly one of the most, we talked about anxiety, and one of the most difficult situations is having to deal with fear of recurrence, the anxiety related to recurrence once you've completed treatment, and living with that and coping with that uncertainty and trying to maintain some normalcy after treatment. There just is an acute and persistent uncertainty that many patients report beyond the completion of treatment. And sometimes it sort of waxes and wanes. It may be reactivated at critical times, such as anniversaries of the diagnosis, follow-up visits. Every time you have an ache or pain or something that doesn't feel right, it may frighten you and stir up those feelings again. Certainly hearing stories of other survivors or other patients that you might know with the same cancer that are not doing well. And so those are realities of living with the disease and living beyond treatment, that there's a certain amount of anxiety that is part of living with the disease, and most patients report struggling some with that and trying to learn how to live with that. And I think the important part is to note that it's very normal, and that acknowledging that it's a part of your life, acknowledging it's something you're trying to learn to live with, is helpful in terms of developing strategies to really live with it. And I think it's important to note that there is a lot happening in treatment centers and across the country in terms of talking about care, ongoing care, and surveillance for survivors. With over 10.8 million survivors in the country, there's a lot of focus now on not only learning how to provide good care for treatment of cancer, but beyond treatment, and surveillance and close monitoring. And a lot of centers now have developed survivorship clinics, and there's a big focus, the Institute of Medicine, on developing survivorship care plans. So there's a lot of attention being paid to really recognizing the unique needs of survivors, really not only physically, but emotionally and psychologically and socially in terms of work life and insurability and the long-term effects. So there's a lot that's happening to provide good support and surveillance and care beyond cancer, and hopefully that's one way that, as a survivor, that some of your anxiety, it will help with some of your anxiety to know that there's a lot of thought and effort being given to how to provide that good ongoing care. And I want to go ahead and move on to talk about adjustment. With loss and change comes the need for adjustment. And as we talked about, once you're able to acknowledge what you've been through, what you're experiencing, then you can take an active role in really making the necessary adjustments. And I think it's hard work, and you know better than anyone, you're living with it. It's it takes a lot of effort. You have to take an active role to really improve your overall quality of life, to overcome fears, to learn to live with them and yet find some joy in your life. And so I want to talk about some strategies. And just to read a quote, Viktor Frankl's, in his book, A Man's Search for Meaning, he writes, "When we are no longer able to change a situation, we are challenged to change ourselves." So I want to move on to talk about active coping, because what we've learned is that patients who are actively involved and engaged in trying to cope with their cancer experience and their survivorship have much better quality of life. And coping really refers to the attitudes and behaviors that you use to maintain your emotional well-being and adjust to stress. It's about identifying and developing strategies to meet the goals and challenges of your treatment, your recovery, and your ongoing survivorship. There are a number of adaptive strategies to help you cope and improve your quality of life, and we're going to talk about some of those. But whenever I meet patients, I always ask them to reflect on their personal strengths. A lot of times patients, as a patient, you don't think about how you got through difficult times, especially when you're in the midst of it. And oftentimes patients who are newly diagnosed will talk about, I'm not sure how I'm going to get through this. And that's when I ask, what kinds of things did you do? What things helped you, provided you comfort through other life crises? And when you reflect on the things that have worked for you in the past, that can be a source of strength for you. And sometimes you don't think about, oh, well, I just got through it, as opposed to really thinking about the specific things that were helpful to you. So I think it's good to really reflect on the difficult times in your life and what were things that really helped you. And those are your unique strengths and coping strategies. And it probably worked well for you, and you may need some additional strategies because of the stress of the cancer, but I think that's certainly a good place to start. Certainly when you're going through a cancer diagnosis and through survival, being actively involved and engaged is so important to getting good care and good quality of life. And we talk about adopting a participatory stance, and that's essentially what it means, that you're going to be involved, you're going to be active, you're going to be engaged in trying to make things better for yourself. Certainly you need good problem-solving skills whenever you're going through treatment, and even beyond in coping with late-term effects and ongoing interactions with the medical system. It's important to learn cognitive, behavioral, and expressive strategies to really help you manage your emotions and reduce anxiety. There are a number of stress management techniques that are available. Certainly it's important to maintain self-esteem, and I'll talk a little bit more about what I mean by that. To nurture the spirit. We're all spiritual beings, whether we're religious or not, and I'll talk a little more about that. And developing a strong network of support. And it's important to believe as well that you really have the ability to change things for the better in your life if you're struggling. And we talk a lot about self-efficacy, and by that we mean that if you have the confidence, self-efficacy is saying I have the confidence and the ability to execute a course of action and to achieve a desired goal. And with that kind of belief, there's a higher probability that you will achieve and obtain those goals. So feeling good about your ability to make things happen is important. We talked a lot about engaging actively and improving your quality of life. I think it's important for cancer patients and survivors, wherever you are in the treatment, to really plan for the future and to really think about the future. It's a way to keep you motivated, and you have things to look forward to if you're going through a rough time. And it expresses a hopefulness about the future. You may need to invest in some changes in your lifestyle as needed. You will certainly need to work to regain some sense of control. When we talk about problem-solving skills, I just want to talk briefly about them, but they're so essential as a survivor. Being able to really seek the information that you need, not only when you're preparing to make decisions about treatment initially, but even after completion of treatment, and maybe even more so because information may not be as easily at your disposal. But it's so important, especially if you're post-treatment and you're experiencing a symptom and you don't know what to think about it. Is it nothing? Is it related to your illness? It's important to get information to understand. And really, that's best done under the supervision of your medical team or physician, just because, again, there's so much information out there on the internet. Some of it's accurate, some of it's not. Even if it's accurate, it doesn't always pertain to you, and it can mislead you. It can be frightening. So it is important that the information that you get is pertinent to you and is under or provided to you under the supervision of your medical team. Certainly, advocating for yourself, again, during treatment, talking about and identifying the things that you need, asking for the things that you need. And as you move into survivorship post-treatment, to really, if you're having problems or something doesn't feel right, to trust yourself and to advocate for yourself, that you should speak up, you should reach out, ask to talk to your doctor, make an appointment. It's important not to ignore those things. You deserve it, and it's important to advocate for yourself. Learning how to negotiate, and negotiating is really about identifying what's important to you, your goals and your values, and setting your personal limits. And that not only pertains to your interactions with the medical system in terms of what kind of care you're getting, schedules, treatments, but it also pertains to your personal life. What is it that's important to you, and what through your treatment and beyond, and what are your limits? You may have to give up a lot of things during treatment, maybe even afterwards. You don't have the same energy level that you did before. You have limits, and it's important to be able to set those limits and say, I can do this, but I can't do that. And certainly communicating your concerns, feelings, and needs. And a lot of patients, I think, feel frustrated at times that, especially in terms of communication with family and friends, they should know what I need, or they see that I'm not able to do these things. And I'm not sure that that's always true. And so it's important to communicate your concerns, feelings, and needs to family, friends, and to your medical team as well. So let's talk about some cognitive behavioral strategies to help you manage your emotions. Cognitive techniques are really based on the premise that the way we think shapes both our emotions and our behaviors in response to events. And so if you are thinking very negatively about something that's happened, that can affect how you feel and how you act. If you're blaming yourself for your cancer because you feel like you had too much stress or you didn't take good care of yourself, that may make you feel depressed. It may make you feel angry with yourself, and it may decrease your motivation to take the steps that you need to get better. So how we think about what's happening does have an effect on how you feel and how you act. And so it's very important to really explore your beliefs, assumptions, and expectations regarding your illness. And cancer is one of those things that mostly we don't really know why it happens, and that's a big question for people. Why did this happen? And so a lot of times patients sort of jump to conclusions in terms of, oh, I didn't do this, or it happened because of that. Sometimes even seeing is it a punishment or being blamed. But those kind of thoughts can really affect your emotions, make you feel worse about yourself, and ultimately decrease your motivation to act. Just as thinking more positively can help you to help lift your mood and help you mobilize you to act in ways that help you get better care. To be able to say to yourself, I know I can get through this. This is hard, but I know I can get through this. And if I can complete one chemotherapy treatment, then I know I can get through 6. And so it's looking at things in a positive light. And even patients who are able to say, yes, this is a disruption in my life, but it's a good opportunity for me to take a break and take good care of myself because I work too much. And so being able to reevaluate, to reframe how you look at things can help you to look at them in a more positive light. And some cognitive strategies are simple things, just positive self-statements and affirmations. And it may seem like it's not very valuable, but they really can have an impact on how you feel. I deserve good care. I know I can get through this. I want to get well. I can take good care of myself. Those are all statements that can help motivate you to feel better and to take action. Another strategy is really to, if you're having difficulty, you're having a problem, or you're struggling with a side effect, or you're struggling to communicate perhaps your concerns with your medical team, or you have to bring up an issue that's embarrassing to you, to visualize yourself solving a problem, to visualize yourself coping with a side effect, or to visualize yourself communicating assertively. And that's a way to really help. It's the mind helping you to feel better about yourself and to take action. So there's a real benefit in these strategies. Just as we know that negative statements and thoughts can really make you feel worse and can really debilitate you and immobilize you from taking action. There are a number of other cognitive behavioral strategies for stress reduction and really just to improve a sense of well-being. Common things like lifestyle changes like getting more rest, reducing your commitments and stress, becoming active. There are a lot of studies being done right now about the value of exercise, especially in cancer treatments and in the survival post-treatment stage. Definitely, healthy eating. And all of these are ways that not only physically can make you feel better, but they're ways that can make you feel better. They can give you a sense of control. I'm doing something active to make myself feel better. There are also a number of mind-body therapies or practices. You may have heard these referred to as complementary or alternative therapies, and there's actually an office, the National Center for Complementary and Alternative Medicine through the National Institute of Health that's really looking at all of these mind-body therapies and studying these, because right now the research and the data is inconclusive in terms of how these actually help. It can be helpful. But many, many patients find these therapies very helpful, and there's an estimate that up to 38 to 40% of patients utilize some type of mind-body therapy or practice. And mind-body therapies are things like yoga and Tai Chi, meditation, acupuncture, guided imagery, relaxation techniques, progressive muscle relaxation techniques, deep breathing, and they're a way of alleviating stress through various mental, some of them are more physical exercises, with the recognition that there is a bidirectional nature of the mind and the body, that what we think affects how we feel in the body, and how we feel in the body affects the mind. And so there are a lot of patients that do experience some comfort, that do experience stress relief. And truthfully, there are studies on relaxation, deep breathing, and inducing the relaxation response and helping with blood pressure and heart rate. And so these are exercises that I would just encourage you to really consider as a way of perhaps feeling better. Again, it's not a substitute for medicine. It's not. It's a complement, and it's a way to help you feel better. One of the techniques that we use a lot at the hospital is guided imagery and visualization. And guided imagery is a technique. It's really what you would call directed daydreaming. It's a way to use the imagination for a specific purpose. And if you can imagine a place that's very comforting to you, very soothing, or a place where you brought you you have a lot of happy memories, that by visualizing that image, that you can actually have an experience of the quality of that reality. And so even though the event isn't real, you get the quality of the experience. And so that's another way to help manage anxiety, and we use it a lot with patients undergoing chemotherapy prior to surgery, and it's something that can be self-taught and something that you can use on your own to feel better. And there's actually a great website, Health Journeys. Belruth Naprostek is someone who's done a lot of different guided imageries that you can purchase and listen to on her website, and we've used those a lot with our patients. And there are a number of other resources. But just to keep an open mind, because we do hear that these different practices can be very helpful. And there is a lot more in the literature and a lot more being studied in terms of the value of these therapies. Certainly any kind of expressive therapies. We have, in addition, we at Moffitt also have a Department of Integrative Medicine that offers all of these services to our patients. And expressive activities. A lot of patients talk about journaling and how helpful that is to write down thoughts and relieve stress. Expressive arts, painting, drawing, music, dance, poetry, any opportunities for expression and emotional release. Certainly it's important to really work to maintain your sense of self-esteem once you've had a cancer diagnosis, because cancer can really strip you of your identity. We've talked a lot about the losses and the impact. It affects your appearance, your physical abilities, your activity levels, what you're able to do, the roles you're able to fulfill, things that brought meaning and purpose in your life you may not be able to do. And so it's important to do things that remind you that you're worthwhile, you're valuable, and that you're important. And certainly one of those things is keeping cancer in perspective, because you are more than your cancer diagnosis. There's so much more to you, and being able to let it recede into the background and have some quality of life is important. It's so that it's not overwhelming and consumes you. Certainly trying to maintain some normalcy in your daily life. And a lot of patients talk about that things that, I don't know, you might have dreaded before your diagnosis, doing the dishes or going grocery shopping or doing the laundry, that seemed like a drudgery. may be delightful once you've had a diagnosis because they just feel so normal. They make you feel so normal again. And strive for acceptance of your situation and self-acceptance, whatever changes that you've had to live with. Find ways to take good care of yourself, whatever that means for you, ways to bring joy to your life, find opportunities to experience humor, and to nourish the spirit through reflection, meditation, and prayer. And we know through talking with patients and listening that patients who consider themselves to be spiritual, that talk about the spiritual dimension of their life, really many of those patients adapt better to the experience, become more accepting, at peace, and are really able to find some meaning in their experience. And spirituality is really, everyone is spiritual. Again, it's not about religion. Spirituality refers to our individual beliefs about an experience of the meaning of life. And so your spiritual practices may include meditation or going to spiritual places, nature, reflecting on your own life, your journey, meaning, and purpose. For you, reading spiritual writings or inspirational writings. Or it may be for you that you're connected to a religious community, and prayer and reading the Bible are helpful to you. So it's really about finding and nourishing that which gives you comfort and peace, hope, self-acceptance, and really a connection. And spirituality, again, is something that helps us to make sense of the world, and especially when things seem random and don't make sense. And so we've discovered that patients who really are able to attach some meaning to the experience or find some benefit in the experience are better able to cope. And Wendy Schlessel Harpham is an MD, and she wrote this wonderful book, Happiness in a Storm, and I'd really encourage all of you to read it. She's a physician who is a cancer survivor, and she was a practicing physician, and then she developed cancer, and then went back to practicing medicine, but then had a recurrence. And she actually ended up having, I think it was 5 recurrences, and she had to close her medical practice. There was no way she could practice medicine. But she started writing books, and she talks about how what a loss it was for her to lose her medical practice, but the joy and the sense of meaning that she gets from being able to help patients through her books. And so that's someone who's sort of taken the experience and acknowledged the loss, but really seen the benefit. And she talks about her life and the changes in a positive way. And so really finding out and what's important to you, looking at what's meaningful, trying to make sense. Has there been anything good that's come of this experience for you? Maybe spending more time with family. Maybe ending a career that you've been trying to get out of for a long time and looking at new opportunities. And it's also very important to really to strive to maintain hope. And hope is really it's not about positive thinking or being positive all the time. And I think the reason that people sort of feel like it's hard to be hopeful is we have such a narrow definition of hope in terms of hope for a cure. But hope is much more than that. And hope is something that's necessary for healthy coping. And its key purpose really is the avoidance of despair and the desire to make life under stress bearable. It's a way of thinking, a way of feeling and acting, and it's really a prerequisite for action. And healthy hope, which is what Wendy Schlessel Harpham talks about, and optimism really can be the driving force in changing your situation in a positive way. And she talks about hope as the belief that there can be a favorable outcome, that you can feel happier, that you can improve your situation, and she talks about it as a choice. And so really strive to maintain hope. And I think one of the ways that, we talked about maintaining normalcy, I think that's certainly a way. And planning for the future, making commitments, engaging in new activities, entering new relationships are all ways of expressing your hopefulness about things getting better and improving. And certainly to get through this and have good quality of life, you need a good network of support. And in order to have a good network for support and build that, you really need to acknowledge your need for help and support through treatment, recovery, and beyond. And these include both practical and emotional sources of support. You may still need help after your treatment is done, practical things, people to help you with the kids and their activities, or people to do shopping for you, or whatever those practical needs might be, as well as ongoing emotional support. Again, we talked about the need to communicate with your family and friends so they know what you need, and so they are supportive. Ask for and accept help, and really seek out peer support, either one-to-one or through support groups. I think it's wonderful for patients to have an opportunity to talk to other patients. You learn more about survival and coping from others, and it's just very helpful, I think, and validating to hear that you're not alone, you're not crazy, that other people are going through what you're going through, and people are finding great strategies for coping and improving their quality of life. And I think certainly consider, if you do need additional help, that there is professional counseling. I know we provide social work services to our patients at Moffitt, and counseling. We have an outpatient counseling program and offer those services when patients need that extra support. Relationships with family and friends. I want to talk a little bit about that, because that's part of that certainly affects your quality of life and your emotional well-being. Sometimes those relationships can be very satisfying, and sometimes when a cancer diagnosis, when you are involved in treatment and even beyond, those relationships can become strained. And it's very important to maintain open communication to allow for expression of feelings. A lot of times in families, there's an effort to protect each other from feelings, and sometimes that lack of communication can really lead to isolation, frustration, and unmet needs. And talking and sharing emotions allows you to work together to resolve problems and to face difficult situations together. And it can happen that feelings and wishes, when they're not expressed or needs aren't expressed, that it's really easy to sort of make assumptions about why people are acting the way they are or not acting the way you think they should, and sometimes can lead to resentment and hurt in those relationships. And then you lose that opportunity for caring for and supporting each other. And families struggle too, partners and friends, and sometimes they don't know how to help. Sometimes they're struggling so much with their own feelings about their worries about you, their fears about losing you, the sadness they feel for not being able to do more. So, and there's no way to know unless you're talking and sharing, and that will really help you to build a strong network of support, people who really understand what you need and who want to be there for you. And so I want to talk a little bit now just about why you, perhaps if you are a survivor, are feeling like things are different for you now, that why you don't feel normal. Again, patients who have just completed treatment or perhaps into survivorship may feel that they're still living with a number of the anxieties and the fears and the worries and the sadness that were a part of the original diagnosis. And that's because really once you've been diagnosed, as a cancer patient and you become a survivor, you're really living an altered life. Things have changed significantly if you really reflect. And you're faced with a lot of challenges still. Even if you're off treatment, there's reentry has a lot of challenges, routines, work, school, social life that has to be resumed. You may need to establish new goals and priorities. You may be coping with fears of stigmatization or discrimination in the workplace. There are insurance issues to consider. You're probably still adapting to some physical changes, maybe adjusting to some possible what we call late effects of treatment, and striving to get good medical care and surveillance, and really trying to cope with your own emotions and those of family and friends around you. So there's still a lot happening, and your life has changed, and there are ongoing challenges. So perhaps the feeling that, why don't I feel better, or why aren't things back to normal, that can validate that things really have changed for you and they're not the same and they don't go back to the way that they were. And so you will face ongoing challenges, and hopefully some of these strategies will be helpful to you. And aiming to really become a healthy survivor. And Wendy Harpham defines a healthy survivor as someone who is getting good medical care and living life as fully as possible. And it's someone who's really learned to integrate the reality of the illness into life during and after treatment. And every person really brings unique characteristics to dealing with illness. It's your particular personality, your way of coping, a set of beliefs and values, a way of looking at the world. And the goal is to take these qualities into consideration and make sure they work in your favor at each point along the cancer journey. And I like this quote from Wendy Harpham. She says, Healthy survivorship is an art. Like all art, you won't find an absolute right or wrong way to do it. Many factors unique to you, your needs, desires, strengths, weaknesses, goals, values, and your circumstances will determine what it means for you to live fully today, tomorrow, and every day. And Jeannie, that's all from me.
Oh, Jolene, your calming voice, I just love the presentation. Thank you so much. Lots of positive feedback in the room, too. Okay, I'm going to hand it over to Moon, our operator for the night, who will give our instructions one more time to ask questions.
Okay.
Thank you. At this time, we will open the floor for questions. If you'd like to ask a question, please press the star key followed by the 1 key on your touch-tone phones now. Questions will be taken in the order in which they are received. If at any time you would like to remove yourself from the questioning queue, press star 2. Once again, to ask a question, please press star 1 now. Our first question comes from Phyllis Rogers in Chicago, Illinois.
Hi, thank you so very much. I was diagnosed with colon cancer, in 2009. And I completed 12 rounds of my treatment. But for the past few weeks or so, I have been in such a stupor that I am just paralyzed to the bed. I don't know if it's because it's coming up to the anniversary time of when my chemo was complete, but I just know that I'm not myself. Whereas I thought I had coped very well, but now I'm beginning to wonder if I need to seek out therapy or what's happening with me. I'm just not feeling like myself. And my well checks with my doctors have been very well. So right now I am still in remission, but I'm just not feeling like Phyllis anymore.
Well, Phyllis, thank you for calling, and it sounds like you've been through quite a lengthy treatment.
Yes.
And I think what you've identified, that you don't feel like yourself, something's not right. Many patients report the same thing. You've been through 12 months of treatment, and it takes a lot of energy not just physical, but psychological, to get up and to go through what you need to go through, to get up and motivate yourself to go through chemotherapy, and to do the things that you need to do to get well. And I don't know what the experience was like for you, but for many patients there isn't a lot of energy to talk about or think about how the whole diagnosis and experience made you feel. Sometimes you sort of put that on the shelf so that you can function on a day-to-day basis.
Okay.
And then when it's over, and you don't have to worry about doing that, functioning in terms of getting up and going to a treatment, sometimes, and you've separated yourself a bit from your medical team, you may not be seeing them as much, then you have a chance to start thinking about, and you allow yourself, maybe not consciously, but to start feeling and experiencing and reflecting on what the experience was like. And so for many patients, it doesn't hit them until after they've completed treatment.
Okay.
That's very normal. And I think that it is very helpful to have someone to talk to. Certainly, if you're so debilitated by how you're feeling that you're not able to get up in the morning and take care of the things you need to, counseling can be a great resource for that. Just to really go back and reflect on and talk about the experience, the losses, the changes, the difficulties. It couldn't have been an easy experience for you.
Oh, no.
And so that's what I think needs expression. And sometimes when you just stuff it down or put it on the back burner, it doesn't show up till later when you sort of slow down and things sort of settle, the dust sort of settles. So I think you probably could benefit from some short-term counseling to talk about what the experience was like for you.
Yeah. Okay. And I guess, too, because I was left with my chemo left me a diabetic. And I've just been so depressed because I'm doing everything, but we still cannot get these numbers down. And now I'm on 3 different medications for the diabetes, and it's just taken a toll.
Well, it sounds like it's not over for you either, as for many survivors, that you're still dealing with some of the complications that the treatment itself creates.
Yeah.
And so I think that you could benefit from some extra support. Again, you've been through a very difficult experience, and you did it successfully. You did what you needed to do, but it takes a toll on you emotionally as well as physically.
Okay.
Thanks, Phyllis.
Thank you very much.
Thank
I
you.
appreciate it. Thank you.
Thank you. Our next question comes from Kristen Keeson in Centennial, Colorado.
Hi, I'm going to try to get to this question. I've cried all the way through your talk. A lot of what you said is what I'm going through, and I've had terrible times where I feel like I wish that cancer would have taken me because it's so much harder being a survivor. And I'm wondering, I know I need to seek some professional help because I'm having a hard time managing life. And I'm wondering if there is professionals that specialize in helping cancer patients, psychologists or psychiatrists.
I think that certainly, there are psychologists and social workers and psychiatrists who work with cancer patients a lot, and so they have a better sense of what your experience has been. And I know that you can often find those specialists at centers, cancer treatment centers. I don't know where you were treated.
I was treated at a hospital, and it was hard to get any information from them. It was hard to even get support group information from them.
Yeah, Kristen, can I interrupt you for a second?
Sure.
I want you to call us tomorrow on the helpline. I'm going to give you that number, and we will help you find some of those resources, as well as maybe match up with some buddies and get you involved in some of our other programs that we have that will help.
Okay.
Okay, the helpline is it's 877-422-2030. But we are here to help you. So I don't. I'll let Jolene quickly finish up with you, but I just want you to know that we're here to help you tomorrow. Okay.
Okay, thank you.
I'm so glad you called, Kristen, and I hope that you will call tomorrow and reach out because you deserve to get some support. This isn't easy, and you deserve the help and support and someone who understands what the experience has been. And there are a lot of professionals out there that can help you, and it certainly sounds like some opportunities to talk to peers could be helpful as well.
Oh, I will call it. Thank you so much.
Make yourself a cup of tea, Kristen.
Take
Deep
care.
breath.
Okay, thank you.
Okay. Thanks.
Thank you. Our next question comes from Cheryl Harley in Schaumburg, Illinois.
Hi. Can you hear me okay?
Yes, Cheryl. Good evening.
Hi. I was diagnosed like at the latter part of right around Thanksgiving in 2005 and went through the 6 months of chemo and 5 weeks of radiation, and in the interim being verbally abused by my husband and my daughter because I had a colostomy bag and it leaked, and they made fun of me, and I don't have friends or family here, and I've had a terrible problem since everything ended, you know, with diarrhea. I have no control. I have, incontinence. Is what they call it, and I've lived with this for years and years and years. It has made my life. I can't even explain.
Cheryl, it's Jeannie. I'm going to call you tomorrow too. I know you and I have chatted many times in the past. I'm going to give Jolene a quick few minutes to address how hard it is for you, but then I will talk to you tomorrow as well. Okay?
Okay.
Okay. Jolene?
Okay, Cheryl, and it sounds like you've been through so much. And I also, encourage you to get some emotional support just because of the difficulty, and it sounds like you don't have a strong support network. But first, you have to get some of your physical problems addressed, and you deserve to get some of those problems addressed and someone to help you manage to really improve your quality of life physically. But also, it sounds like Jeannie can help connect you. There are a number of, I know, support programs for ostomates, and, sometimes wonderful suggestions from others who've really learned to manage. But it's also important first, too, to get medically to get those kinds of concerns addressed.
Thanks, Jolene.
Take care, Cheryl.
Thanks, Cheryl.
Thank you.
Thank you. Our next question comes from Randy Henninger in Folsom, California.
Hey, Jeannie. Hey, Jolene. How you doing?
Hey, Randy.
Hi, Randy.
Yeah, I just, 27 years of being through this, and I got to tell you, this has been the most concise, helpful, and insightful dredging up of emotions that I have ever experienced. I just want to thank you so much and say that it's been my experience. Now, remember, I went through this 26 years ago.
Uh-huh.
When I was done with treatment, I was basically on my own.
Mm-hmm.
Fortunately, I had a great support network in my family. But the whole idea of a program of emotional and spiritual support, the way that Jolene is laid it out, is just got a hold of me and is so powerful. Again, thank you so much for this and for opening my eyes to how much more there is available. How can we get this out to, the folks that like me who are long-term survivors and didn't get exposed to any of these opportunities, and to new survivors, as we've heard expressed on the phone here tonight, that are just still being really torn up emotionally.
Good question, Randy. Thanks for your nice comments, too. Randy's a longtime CCA buddy for us. We do have this recorded, Randy. It will be on our website on Monday. It will be there forever. And that's the beauty of the new technology, is there is going to be a lot of resources available for newly diagnosed people, at their fingertips. And more National Cancer Institutes like Moffitt, as Jolene was saying, are developing these programs. So we're getting there. You want to add anything, Jolene, to that?
No, again, thank you for those nice words, Randy, and I think it's so helpful, too, for survivors to hear from other survivors who have done so well.
Thanks.
Thank you.
Thank you. Next question is from Jean Angelette in Pacheco, California.
Hi. I haven't survived as long as Randy has. I've been going at this with stage 4 for over 6 years now. And I was wondering if you could talk a little bit or somehow address how the emotional needs of long-term survivors. I'm stage 4 and I'm on my 5th course of chemo. I keep having recurrences. So long-term survivors who continue in treatment, it's kind of a different ball of wax than someone at stage 1 or 2 treated, and they have their issues going forward through life, and we have ours too.
Right. And Jolene, may I just interrupt here that we have a significant number of survivors in Jean's boat that are 5, 6, 7 years out, pretty much in active treatment that whole time. Which is the good news, is they're still with us. Yeah.
Well, I think we're seeing a lot, as you said, yes, a lot of survivors, but individuals who are living with an advanced cancer, but it's under control, and you may have periods of remission where you're off treatment and then periods where you go back on. It's really about, and this is the challenge, is living with chronic, it's the cancer for many patients has become a chronic disease. It doesn't go away. It's not cured, but it recedes. It's not, you may be in a phase where you're not in the middle of treatment or not experiencing symptoms. And so I don't have any magic bullet or solution. It's really learning to live with that uncertainty and being able to know when it should be, when it needs your attention, and when it can be sort of put in the background and your life can go on. And I know for long-term survivors that are still, stage 4, that making plans sometimes is challenging. But what do I want to do in terms of my future and work? And I know it's very disruptive. But part of living with it, I think, is learning to really be able to have hope that things will get better, and to be able to make plans and interrelationships and commitments. But I suspect, and you know this better than I do, Jean, that there are disappointments when things flare up again and you have to go back on treatment, and it disrupts. And I think, some of the strategies that we talked about are ways to just, it's not going away. It's part of your life. It's something you will be living with, and learning to balance it. But it doesn't have to rob you of all quality of life and joy and happiness and relationships and doing things that are meaningful for you.
But I just want to add in that, for example, in my situation, I'm not really ever out of treatment for very long. And honestly, I don't know if there's ever a time I stop thinking about having cancer. Whether it's a side effect I'm suffering through, or experiencing is a better way to put it, I guess. Or if it's knowing that my time off of chemo, a little chemo break, is only going to be a few months before it starts growing again. Last time I didn't get to what they call remission. I don't trust the word remission anymore. So I've learned from my friends in the Colon Cancer Alliance community that, yes, I can have some hope, even though one doctor told me I'll probably never, ever be NED again. He doesn't know. I mean, he may know, but there are treatments coming up in the pipeline.
Yes.
I could be NED again. I could cure this or be rid of it forever. Who knows? And that's what we live for. But cancer doesn't leave my plate ever.
I think, Joanne, what maybe we could review again real quickly, because you brought up so many good points with Jean and some of the other long-term stage 4 survivors. How do you get it? How do you make it so that it's not monopolizing your entire pie? You know, any concrete, other than consciously try, as you gave many great examples of consciously, you know, trying to talk to yourself and focus on the good and that sort of thing. But I think the challenge for Jean and others is not having it monopolize every piece of your life and your pie.
Good way to put it. Thanks.
Well, it sounds like if you're in treatment, that is pretty consuming. That's your job to, you know, to go to treatment and to take care of yourself, whatever your regimen is, whatever the recommendations there are. But I don't know that there are ways other than acceptance that this is the reality, and trying to, when you have moments that you don't have to be involved in treatment or you're not feeling sick, that seize those moments to do things for yourself, to really, again, find some pleasure and meaning in life, because if it's part of that much a part of your life, it isn't going away. And so it's accepting this is a part of my life, and this is what I need to do. And it sounds like, Jean, that you've been very good at sort of helping yourself to see it in an optimistic light, that you do have hope that things will get better. But I don't.
And I work at it.
Well,
it takes work to have that hope.
I think it does. I mean, that's what it sounds like, that it takes work to keep your spirits up. But it sounds like, as much as you would like this to not be a part of your life, that you've found ways to manage. And again, I think that's what there is. I think it's making choices about how you think about it, about what actions you take, instead of laying in bed all day, that when you do feel good, that you do things that you enjoy. On the days that you don't have to have treatment, that you do something you want to do. But it's really about making choices and working at enjoying the time that's not consumed by cancer.
Okay, thank you.
Thank you. Next question comes from Dave Whitehead in Denver, Colorado.
Good evening.
Hello.
I'm Dave Whitehead. I am a cancer survivor of stage 4 colon cancer. I was originally diagnosed in 1997. My last procedure was in 2003. My concern that I hear is that I understand that people are very, they're struggling a lot with dealing with the emotional issues connected with cancer, and believe me, it gets better. The longer you survive, the better it gets. But what I wanted you to maybe discuss are dealing with the chronic illnesses that will be associated in the future, that you can look out for, that you can expect, you can deal with. You've been through probably one of the worst experiences in your life. It will make you stronger. But you've got to keep dealing the rest of your life with the fact that you are a cancer survivor.
So what has helped you, Dave? What do you think has helped you with this?
Well, I wish I knew exactly. Number one, my wife was an excellent caregiver. Provided a great deal of emotional support. Another thing, I guess, is that I decided after I reached my lowest point, which was a few months after diagnosis, that I was going to fight it. I had reached a point where I was going to give up, and then she turned me around, and it takes work. It takes emotional work, and it takes physical work. I would highly recommend to everyone that's going through, I guess, post-chemo, start finding yourself a way to exercise. I think that the physical aspect of dealing with whatever treatment you have, the physical activities will help you deal with whatever issues you have, and quite often it's scar tissue and other things if you've had some operations.
Mm-hmm.
I wish I could tell more to the people who are reaching the end of chemo. It's going to get better. Trust me. Believe it. The reason that you went through all of that is to get to where you are now.
We appreciate that, Dave.
The best thing you can do is don't dwell on what you've been through. Think about what you got to do and what you want to get to. And you will, believe me, stop thinking about cancer every minute, every 10 minutes, every 15. I go for days now and never think about it.
Great. Thanks, Dave.
Thank you. And I think that, again, I think this is where those of you who are living with stage 4 disease can be so helpful to each other in terms of the strategies and the ways that you're learning to live long-term with the disease. So thanks, Dave.
Certainly.
I think we have time for one or two more questions, Moon.
Right. Our next question comes from Lori Coulter-Jerome in Monongahela, Pennsylvania.
Yes. That's it. I have a question about just the basic fear. I mean, it's just like I was diagnosed last year in February. I was 48. I'm 49 now. And my doctor says I have a very good prognosis. I had stage 2A cancer, went through chemo, but I'm finished with chemo, had my first PET scan. I was clear. I'm due for another PET scan here in May 9th, and I'm just terrified every day of my life. I just feel terrified.
Terrified of what?
Just terrified of leaving my family. Just terrified, even though I'm told that I have a very good prognosis, I just cannot let go of this fear. I just feel like every day, I feel like I'm just being like almost tortured and terrified by this.
And have you talked with anyone about this?
Not really. I mean, my husband basically, but I mean, I just feel that, if I go to see somebody, they're going to tell me, I feel like if you go to talk to somebody and they're just going to tell you it's going to be okay, or whatever, and that's still not going to take away that I was diagnosed with cancer. And in your talk, you had said you lose that sense of well-being. And I think that that's the main thing that I've lost. I've lost that whole sense of well-being, and that I'll never get it back again. And, that you'll never be the same person that you were before. So that's basically, how do you live with the fear?
Well, I think, I think a certain amount of fear and anxiety is normal. I think when it's as intense as you describe it, that is not something that you want to live with on a daily basis, because that must be interfering with your life. When I hear the intensity with which you describe the fear a year later, and I don't know exactly what the specifics of your situation or what things have happened or been said to really intensify your fear. I don't know if you're someone that struggled with fear in the past or anxiety. But
yeah, I did have anxiety in the past.
I do think it's worth exploring. Counseling is not for somebody to say to you, it's going to be all better. Counseling is a way to work with you, to explore, to listen to you, to hear, to try to find ways working with you to feel better and to get at the source of why your fear is so intense right now. Not that fears are abnormal, because they're not, but when they're that intense, I think it merits an opportunity to talk about why it's so intense and why it hasn't subsided some.
Right, I think it's just the fear of death. I think the fear of death has been put in me, and I feel like I can't look at growing old anymore. Like, I just feel like I don't look towards, the 70s and the 80s, and getting old, and I'm afraid that I'm never going to get old.
And again, I think that is normal. That that threat to your mortality. It's not something you get back once you've lost it with a cancer diagnosis. But to help, counseling can help you put some of your fears in perspective and to learn some strategies. You're someone who really might benefit from some guided imagery and relaxation. Those strategies can be very helpful for someone who's got a lot of racing thoughts and a lot of anxiety. Those are good techniques to help slow the mind down and quiet and calm the mind, and the accompanying bodily reactions. And so those might be good strategies for you. But I think with the guidance of a good counselor, you could not only explore some of your fears, and sometimes just even openly expressing them and talking about the specifics can help reduce the intensity, but really exploring the source and the depth and ways that you can feel better. I think it really could be helpful.
Okay. Thank you.
I hope you get some help.
Thank you.
Take care, Lori.
Moon, do we have one more question?
Yes, ma'am.
Okay.
Next question comes from Ed Hall in Bellefonte, Pennsylvania.
Oh, Ed.
Well, I didn't really expect this. I didn't know I was going to come on. Mine isn't really a question.
Mm-hmm.
I would like to offer help if I'd be glad to talk to Christine if that would be helpful at some point. But to address a couple of the issues where people need sort of an immediate relief. This goes to the person who had stage 4, who's saying that their problem is different. I mean, just off the top of my head, I guess I'm a 7 to 8 year survivor. It does get better all the time. I don't think about having cancer or fear of death hardly at all anymore, but I had a lot of bad results from treatment, and that bothers me every day, but it's something that I'm sort of dealing with. One of the things I found helpful is I'll come across something like stages to meditate or pray, and for whatever reason, those written words or guidances draw me into now, into this second, into this moment. And sometimes I come across meditations by a Zen master, and sometimes they're to music, but they draw you into the very present moment. And by being present now, you're not obsessed with fears and projections into the future. You're not obsessed with your resentment and regrets over the past. And for me, it's good for everybody to focus on now. It gets you out of all that mental turmoil.
Thanks, Ed. I appreciate your thoughts, and I appreciate your offer to be buddies and letting everyone know we do have a wonderful buddy program. Many of the people that spoke tonight, Randy, Jean, are buddies for CCA. Our online community has message boards where maybe someone could post a thread about how do you cope with the fear of a recurrence, how do you cope, and we can start those threads going. A lot of this has been what works for one person may not work for another, but I'm going to throw it over to Jolene for her closing thoughts, and Ed, thanks for calling in.
Thank you.
Yes, thanks, Ed, and thank you all for this opportunity. I hope that there were some thoughts that were helpful to you, and again, I think the support that you receive from each other, the knowledge and the wisdom gained over the experience from each other is a very beneficial way to really help you to cope with ongoing survivorship and to really utilize the resources out there. You're not alone. There's a lot of help in many ways. You deserve good quality of life, and so please do seek out that help. And thank you for this opportunity.
Well, Jolene, thank you so much. It was a wonderful presentation. The question and answer session was wonderful. We appreciate it very much. I want to thank you all for coming. We appreciate this opportunity to, give presentations like this to you. We do think it helps. We do want you to know you're not alone. I would like to thank our vendor, Conference America, and our operator, Moon, for his time tonight and the help behind the scenes. We are working on next month's Telechat topic, which will be mind-body medicine, techniques to calm the mind and heal the body. Watch the website for details on that. We do meet in our chat room every day, 12 to 1, for friendship and support. So if you're 12 to 1 Eastern time, and then the other Wednesday nights, 8 to 9, again, is friendship and support. The first Wednesday is always our guest speaker. I'm going to remain in the chat room for a little bit so we can visit. But again, I want to thank you all for coming, and another thanks to our speaker, Jolene. You guys all have a good night.